Open the distal femoral canal. Determine the valgus angle. Assemble the distal femoral cutting block. Verify the femoral alignment. Confirm the amount of bone resection of distal femur. Perform bone resection of distal femur. Femoral sizing. Adjustment and determine the adequate amount of bone resection. Drill the hole with 3 degrees of external rotation. Install the 4-in-1 cutting block. Make sure the scale points at 0. Inspect the amount of bone resection of anterior femur. Adjust and reduce the amount of anterior femur by 2 millimeters. Inspect the amount of bone resection of anterior femur again. Adjust and increase the amount of anterior femur resection by 1 millimeter. Confirm the amount of bone resection of anterior femur. Perform bone resection of anterior femur. Perform the bone resection of distal femur accordingly. Assemble the intercondylar bone resection guide. Perform the intercondylar bone resection. Rounded intercondylar bone resection, less bone resection, and stress distributes. Position the trail femur. Drill the femoral aligning hole. Tibial clamp assembly. Adjust the jig to make it parallel to the tibial mechanical axis. Assemble the tibial cutting block and stylus. Verify the amount of resection of the tibial plateau. Remove the tibial clamp assembly. Confirm the tibial alignment. Perform the tibial plateau resection. Confirm the extension and flexion gap with the spacer. Verify the alignment again. Fix the tibial trail. Attach the drill tower to the tray trail. Perform tibial tray, forming bone resection. Install the tray trail and reposition the joint. Remove the trail implant. Tibial and femoral implantation. High flexion of 145 degrees.